Good morning, everyone. Bonjour à toutes et tous. I'm Leslie Church, the Member of Parliament for Toronto St. Paul's. I want to begin by acknowledging that we're gathered on the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Wendat peoples. Thank you all for being here today. Merci d'être ici aujourd'hui. Across the country, we know people are feeling the strain in our healthcare system. We hear it right here in the heart of Toronto's wonderful health network. And we know many Canadians are still working hard to get the care they need when they need it. There's no single solution to these challenges, and no level of government can solve them alone. That's why I'm especially proud to welcome Minister Lena Metlege Diab here this morning. I have the privilege of working closely with her, and I can tell you this. She brings an enormous amount of dedication, compassion, and focus to the immigration file. She is constantly pushing for solutions that make our system stronger, solutions that help communities, help newcomers, and yes, help our health workforce right across the country. And today, you're going to hear about work that reflects exactly that spirit. I won't give anything away, but I will say that her leadership is driven by a deep commitment to delivering real, practical results for Canadians. Many of you know her strong record of public service from her time as Nova Scotia's Minister of Immigration, Minister of Justice, and Minister responsible for la Francophonie, to her federal role representing Halifax West. After the 2025 election, she was appointed Minister of Immigration, Refugees and Citizenship by Prime Minister Mark Carney. We are very fortunate to have her here with us today. So please join me in welcoming our Minister of Immigration, Refugees and Citizenship, the Honourable Minister Lena Metlege Diab.
Thank you very much, and thank you to the Member of Parliament for Leslie Church. Thank you for being here and hosting us today. Merci à toutes et à tous d'être ici aujourd'hui et bienvenue tout le monde. First, I've already thanked my colleague Leslie Church, the Member of Parliament for Toronto St. Paul's, who's also the Parliamentary Secretary to the Secretaries of State for Labour, for Seniors, for Children, for Youth, and Minister of Jobs and Families. Of course, welcome to my colleague, Parliamentary Secretary for Health, Ms. Maggie Chi. Thank you for the important work for supporting Canada's health system. And you will speak right after me, so that's great. I'm also grateful today to the University Health Network for hosting us, and to everyone who's taken the time to participate in today's announcement. So Dr. Catherine Pinkham, thank you very much, Physician-in-Chief here at the University Health Network. And to Dr. Margot Burnell for flying here, President of the Canadian Medical Association. So we're meeting today, in the month of December 2025, so near the end of a long 2025 year. And we know that for Canada's healthcare system, the last several years, particularly since COVID, things have not been easy. Nous sommes ici près de la fin d'une longue année et nous savons que les dernières années ont été difficiles pour le système de santé du Canada. Nous avons vu la pression dans les urgences, nous entendons les familles qui attendent un médecin et nous voyons le personnel de première ligne qui est très fatigué. So we've seen the strain in our emergency rooms. We hear it from families waiting for a doctor. And we feel it from the frontline staff who are stretched thin. In fact, yesterday, I actually flew in yesterday and I attended Mass in Toronto. And one of the parishioners came to me afterwards, who was a healthcare worker, and said to me, I'm doing 3 shifts in the hospital in Toronto. Thank you. I heard you're doing something tomorrow morning about that. So we hear it, we see it, we know it's there all across Canada. There is no single solution, and while credentialing and licensing are under provincial authority and professional regulators, As Minister of Immigration, I know the federal government still has a role to play, a very important role. As such, our government has been adjusting immigration levels to bring the system back into balance and reduce pressures on our services and communities. But a balanced system is also a responsive one. Notre gouvernement ajuste les niveaux d'immigration pour ramener le système à l'équilibre et réduire la pression sur nos services et nos communautés. Mais un système équilibré doit aussi être flexible. It means that as we return to sustainable levels, we must simultaneously attract the high-skilled talent that will help relieve those pressures, particularly in key sectors like healthcare. We've heard a clear message from patients, provinces, and the medical community. We need more hands on deck. There are qualified doctors, many here in Canada, on temporary status, and some abroad, who are eager to serve Canadians. Yet too often they face barriers, delays, and uncertainty. Beaucoup de médecins qualifiés, plusieurs déjà ici avec un statut temporaire, d'autres à l'étranger, veulent travailler. Mais trop souvent, ils font face à des obstacles, des délais et de l'incertitude. Over the last few months, I asked, the departments asked, our provincial and territorial partners, what do you need from us to get doctors working faster? Their answer is clear. Give us the space to recruit, give doctors the certainty to stay, and move at the speed of the crisis. This is why today is an exciting day, because today we are answering that call. Je suis heureuse d'annoncer plusieurs mesures pour recruter les médecins dont nous avons besoin, garder ceux que nous avons déjà, et accélérer les délais de traitement. So today I'm pleased to announce a suite of new measures to recruit the doctors we need, to retain the ones we have, and to cut processing times to ensure it all gets done quickly. So these are three important things, and let me just explain to you what that means. First, we are empowering the provinces and the territories. These are my provincial and territorial colleagues that I have been working with for the last 6-7 months. We know Canada needs more doctors, but healthcare needs look different in downtown Toronto than in rural Saskatchewan. Provinces and territories are best placed to determine where their pressures are greatest. So, we are reserving 5,000 federal admission spaces for provinces and territories to nominate licensed doctors who hold job offers. Nous réservons donc 5,000 places fédérales pour que les provinces et territoires puissent choisir des médecins autorisés qui ont une offre d'emploi. These are dedicated spaces over and above the annual allocations. So when a province or territory finds a qualified doctor, federal caps will not be a barrier. We are giving them the room they need to staff up. Second, deuxièmement, we are deploying federal tools to support this effort. We are launching a new express entry category specifically for international doctors with at least 1 year of Canadian work experience in the present years. Nous créons une nouvelle catégorie entrée express spécialement pour les médecins internationaux qui ont 1 mois 1 an d'expérience de travail au Canada dans les 3 dernières années. Many of these doctors are already treating patients in our communities. We cannot afford to lose them. So today's announcement will open the door for eligible doctors who are already here to create or update their express entry profile now before we start sending invitations to apply in 2026. It signals to every doctor here temporarily that we value you and we want you to stay. C'est un message clair pour tous les médecins ici temporairement. Nous vous apprécions et nous voulons que vous restez. This measure is Canada's international talent attraction strategy in action, which we have announced in Budget 2025. It reflects a levels plan that is targeted, that is streamlined, and that is responsive. Elle montre que notre plan de niveau d'immigration est ciblé, efficace, et flexible. It ensures that we restore balance to the immigration system, that we are laser focused on locking in the essential talent that drives our economy and keeps our social infrastructure strong. Thirdly, as I said, there's 3 items. Thirdly, and effective immediately, for provincially selected doctors, we are offering expedited processing of work permits, and I can tell you that's a big deal. A doctor will be able to secure a job, get nominated by a province or territory, and have their work permit processed in just 14 days, allowing them to focus on what matters, treating patients while they wait for permanent residency. So, un médecin pourra obtenir un emploi, recevoir la nomination de la province et faire traiter son permis de travail en seulement 14 jours pour qu'il puisse se concentrer sur les patients en attendant la résidence permanente. This targeted approach builds on the work we recently did to attract and retain international graduates. So just as we refined our tools to keep the bright graduate students our economy needs, we are applying that same precision here. We're moving away from a one-size-fits-all approach toward an immigration system that targets the professional Canada needs most. These measures send a clear signal to international doctors, offering clarity and a path forward to work and live in Canada. Ces mesures envoient un message clair aux médecins internationaux. Vous avez de la clarté, un plan et un chemin pour vivre et travailler au Canada. Whether you are a specialist in clinical and laboratory medicine, our wonderful cardiologists, dermatologists, emergency physicians, oncologists, pediatricians, and psychiatrists, or whether you are a specialist in surgery, our amazing obstetrician, gynecologists, thoracic surgeons, general surgeons, pediatric surgeons, and of course, our general practitioners and family physicians. And I've only named a few of the categories, just to give the flavor of how important and meaningful this will be for the Canadians that need the healthcare service. I want you all to know how much we value your work as doctors trained in these occupations. Je veux que vous sachiez à quel point nous apprécions votre travail. These barriers we are removing today, and the measures we are putting in place to recruit and retain our doctors will have a significant impact on the lives of everyday Canadians and the services they will receive. Every time we remove a barrier for our doctors, we close the gap for a Canadian waiting to be seen. Les obstacles retirés aujourd'hui et les mesures mises en place pour recruter et garder nos médecins auront un vrai impact sur la vie des Canadiens. I want to thank all those involved, including those here today, and I see my colleague, Member of Parliament Jean Yip, as well, right here, and my colleagues in our provinces and territories for their honest and dedicated collaboration. These are necessary steps to build a healthcare workforce that is robust, diverse, and ready. We are committed to ensuring continuity of care for patients and strengthening system stability at a time when Canadians need it the most. Let me now introduce MP Maggie Chi, MP for Don Valley North, who's the Parliamentary Secretary to the Minister of Health. Thank you.
Thank you, Minister, and good morning, everyone. Bonjour tout le monde. My name is Maggie Chi, and I'm the Member of Parliament for Don Valley North and the Parliamentary Secretary to the Minister of Health, the Honourable Marjorie Michel. And I'm so excited and pleased to join you today at UHN Canada's leading research hospital. Thank you for hosting us. It's incredible to be here. And thank you, Dr. Burnell, for being here for the announcement. And I'm also very pleased to be joined by my colleagues, Minister Metlege Diab, MP Leslie Church, and MP Jean Yip. And it's a true pleasure to be here to talk about what our government is doing to strengthen the healthcare workforce and the issue that affects every region of the country. As Minister Lena Metlege Diab touched on, there are many internationally educated physicians already working in Canada on a temporary basis, helping patients and contributing to our healthcare system. We're now giving them a clear pathway to permanent residency so they can stay in Canada to fill critical health workforce gaps. Today, our government is announcing targeted immigration measures to help grow Canada's health workforce, an express entry category for internationally educated physicians with Canadian work experience, as well as 5,000 bonus provincial nominee program spaces to provinces and territories that nominate practice-ready physicians with job offers. These are physicians who are already working in Canada on a temporary basis, helping patients and contributing to our healthcare system. We're helping them stay in Canada so they can continue providing care to Canadians. We are driving progress by working collaboratively and strengthening system capacity and infrastructure. That includes supporting the immigration of skilled health professionals like physicians with Canadian work experience who have the expertise our healthcare system needs. Supporting and growing the health workforce will help ensure that many Canadians who are waiting for necessary care can get it. Today's announcement builds on ongoing work to create new training positions for international medical graduates, expand assessment capacity, and develop navigation supports to make credential recognition more efficient. This work builds on investments that help internationally educated health professionals join workforce much more quicker. We're also helping internationally trained workers obtain the necessary credentials to work in Canada. Budget 2025 is launching a Foreign Credential Recognition Action Fund to help internationally trained workers in healthcare and construction get their skills recognized faster so they can contribute sooner. Budget 2025 also allocates $5 billion to the Health Infrastructure Fund. This will help provinces and territories ensure their health infrastructure, hospitals, emergency rooms, urgent care provider centers, and medical schools is able to respond to the healthcare needs of Canadians. All these efforts have a single goal in mind: to grow and strengthen Canada's health workforce so every Canadian can access care when and where they need it. Provinces and territories are absolutely our key partners on this. Together, we're working to address health workforce challenges such as retention, we're improving labor mobility, and we're increasing the sharing and standardization of workforce data in healthcare. Today's announcement is another step forward. The additional immigration spaces to nominate practice-ready physicians will give provinces and territories the flexibility to respond to urgent healthcare needs. And the targeted immigration measures will make it easier for internationally educated physicians to stay in Canada, contribute their expertise, and deliver care. And that's what our country needs right now: a strong, qualified healthcare workforce ready to support Canadians. because building a strong Canada starts with healthy Canadians. And thank you very much. And next up, I would like to invite Dr. Burnell for Canadian Medical Association.
Good morning, everyone, and thank you, Parliamentary Secretary Chi, for the introduction. My name is Dr. Margot Burnell. I'm a medical oncologist from New Brunswick, and I'm currently serving as president of the Canadian Medical Association. For over 30 years, I've seen the human impact of a health system under growing strain, and the gaps are particularly great in primary care. A recent report by Health Canada found that Canada is short almost 23,000 family physicians. Millions of people are being left without access to care as a result, and the physicians we do have are put under extraordinary pressure to try to fill the gaps, an impossible task. Today, we applaud the federal government for recognizing one of the ways to help close this gap, making it easier for international physicians to practice in Canada by removing some of the friction points in the process, from immigration through to practice. Currently, it's estimated that around 13,000 internationally trained physicians in Canada are not working in their field. The changes announced today will help put their skills to work sooner, close staffing gaps, and provide more support to patients. Today's changes are an important step to addressing these challenges, and we look forward to continuing to work with the federal government on other measures that will improve access to care. The CMA is recommending a concierge-style pathway to guide internationally trained physicians through every step of coming to Canada and getting licensed to practice. That would include coordinating immigration, regulatory assessment, and employment pathways. It's important to also create a single intake portal to assess training, exams, and immigration eligibility, including background criminal checks and certificates of good conduct. Even with more physicians entering Canada, our current licensing frameworks limit how and where they can practice. A pan-Canadian licensure system would make things easier across the board, allowing all doctors to move more freely across provincial and territorial borders and work where the need is greatest. Such a model would also help with the delivery of virtual care, which could significantly benefit patients in rural and remote communities. It's a practical reform that could deliver results quickly. Training is another important part of the equation, and more investments are needed in medical schools and training facilities so we can expand our capacity to train new doctors. We also look forward to collaborating with the federal government on integrated health workforce planning, because delivering the right care in the right place at the right time will take more than simple addition. By planning the health workforce together at a national level, we could deliver more care in teams, the best way to take care of patients. We could make access fairer no matter where people live, and we could stop physicians and other care providers from burning out. Now is the time to align immigration, training, licensure, and workforce planning into one coherent, sustainable system, one that serves both patients and providers. Canada's physicians stand ready to partner with governments in that effort. Thank you, merci, miigwech. I'm now pleased to invite UHN Physician-in-Chief, Dr. Catherine Tinkham, to the podium.
Thank you so much, Dr. Burnell. Good morning. My name is Catherine Tinkham. I have the privilege of serving as the Physician-in-Chief at the University Health Network. It's been our pleasure to provide this beautiful space for the federal government announcement of plans to create a more sustainable healthcare system across our incredible country. At UHN, we continuously strive to do the same. This very building is an example of that. Acquired last year, it's undergoing a transformation into a hub for the early detection of cancer and cancer education. The work and discoveries that will happen here will benefit people all across Canada. Physicians have a unique role in caring for patients of all kinds, and there is no question that making it easier for physicians to establish a stable career in Canada benefits all of us. What we've heard today here is most encouraging. Thank you, Minister Diab. We are deeply committed to nurturing the tremendous talent in Canadian healthcare workers. And we are strong proponents of recruiting the best and brightest from all around the globe to help us deliver world-class care. Improving the pathway to permanent residency for doctors increases the appeal to working in Canada. And the support of this government to further enable Canada to be a world leader in healthcare and research is the most welcome news. Thank you so much for being here today.
Gentlemen, we will now move on to our question and answer session with the media. I'm Marianne Boyer, Director Media Relations and Ministerial Services for IRCC, and I will be your moderator for the Q&A session. Ça me fait plaisir de modérer la séance de questions et réponses. Participation in the question and answer portion of the event is for accredited members of the media. La participation à la partie questions et réponses de cet événement est réservée aux membres accrédités des médias. I'd like to welcome those who are joining us by phone as well. J'aimerais également souhaiter la bienvenue à ceux et celles qui se sont joints à nous par téléphone. You're invited to ask questions in the language of your choice. Please state your name and media outlet. You are allowed to ask one question and one follow-up question. Who's first? Yes. I'll just come to you with the mic.
This is sent to me. I'm Ron from Omni Television. Omni and Leger polled newcomers to Canada and found that the majority say Canada should admit less than 300,000 new immigrants per year. Newcomers are also split over whether your government's immigration policies are an improvement compared to the previous government's policies. Do you feel like you're on the right track?
So Canada's taking a focused, strategic approach to attracting and retaining the best talent in the world. Today's announcement is attracting the healthcare talent that we need to deliver better care for Canadians, while also restoring the long-term sustainability of our immigration system. We have released an immigration levels plan that is very clear, that stabilizes our permanent resident, that also decreases the temporary resident population, that has clearly identified, which we will talk on in stages of attracting the best talent. Today is one of those attraction policies, and we also have a focused Francophone immigration plan.
Okay, and the follow-up is, the Omni Leger poll also found that 1/3 of newcomers say the temporary foreign workers program is taking away jobs from young Canadians, and that Ottawa should only allow temporary foreign workers in specific industries. Are you committed to capping the program further? If so, when can we expect the new changes? Thank you.
So the temporary foreign program has a place in Canada. We've heard clear from provinces and territories, particularly the rural and north communities, that they value the work that some of the temporary foreign workers are playing. We also have released the numbers. It is much lower than it has been. The program itself is about a 1% of the targets. So we've got clear targets for the next year, and we will continue to work with our provinces and territory to identify where they need to fill labor gaps, because it is there to bring in people to work in where we have shortages of non-Canadian people. It's certainly not there to fill jobs that Canadians can do themselves.
Thank you. I understand we have no question online. Any more question in the room? No question. Okay. Well, thank you very much.
Thank you.
If media do have any further questions, you're welcome to contact media relations staff listed in the media advisory. Thank you to everyone who has joined us today.